We are again joined this afternoon by the director of the Greater St. Louis Metropolitan Pandemic Task Force, Dr. Alex Garza, joining us live from Creve Coeur this afternoon. Dr. Garza, thank you again for your time.
Sure. Good afternoon.
Well, hospitalizations had been steadily, we've seen, going down before flattening last week. How concerned are you at this point that the decrease in hospitalizations has actually stopped during this pandemic?
Well, we always knew it was never going to get to zero. And so we believe what's happening now is we're getting into that point where we're sort of at this steady state where we're always going to see patients coming into the hospital with COVID, and that's until you get vaccine or until you get herd immunity in the community. Of course, we'd like to see that number continue to go down. But right now we seem to be hovering around that 15 to 16, sometimes lower, sometimes a little bit higher mark. As long as we don't see that dramatic jump in hospitalizations, we feel pretty comfortable with that right now. It's certainly a number that we can handle as a healthcare system, but certainly we don't want to see that number go up.
Today, another big day in St. Louis County where we increase capacity limitations in restaurants as well as businesses to 50%. So we went from 25 to 50%. Do you think we are opening up too much too soon?
Always a challenging question to answer. If you look at the hospitalization data, we look like we're doing okay. I know the case counts have been ticking up a little bit, and so that's always a little bit of a concern. But overall, we seem to be doing well. So I think the question more is, are we practicing all of those important things that we've been preaching about, such as wearing masks and social distancing and hand hygiene, so that we can allow ourselves to open up a little bit more. And we'll keep an eye on the data from the relaxation to make sure that we're not seeing that uptick. And so it's still, I think the jury's still out on that.
It is no secret we have seen a spike in cases across Missouri, at this point more rural than in the metro area, but our numbers here, we can't ignore them in the St. Louis area. There's an uptick in them as well. Is this a result of more testing or just an actual increase in more cases?
Well, it's probably a little bit of both. So obviously we do have more testing than we had, say, a month ago. And so when you do more tests, you're going to find more positives. And so that's easily explainable. So then the question is that a reflection of increased transmission in the community? We haven't seen a jump in the percent of positives in the testing that we do. So if you look at all the tests, what percentage of those are positive? We've been holding steady at that, so we feel pretty comfortable that it doesn't relate to an increase in transmission. But it's really difficult to tell because there's a lot of asymptomatic carriers and low symptom carriers out there that are never going to get tested. So challenging question to answer.
Have we seen any local cases, we're intrigued by this, where people have contracted COVID-19, recovered, and then perhaps tested positive again? So in other words, are we sure that catching it guarantees immunity for you?
So the immunity piece is still an open question. So there are some case reports where people have tested positive for COVID, contracted the disease, recovered from the disease, and then tested again. But we believe that that second positive test is probably from dead viral fragments that are still sort of hanging around. The test will pick up those genomic pieces, and the test will become positive. So the question is it live virus or is it dead viral particles that are sort of still hanging around and allowing that test to become positive? The immunity piece is still an open question. How immune does a person become after they're infected seems to be dependent upon how sick they get sometimes. So able to generate a large immuno response or a very mild one. Questions still out on that one too.
Well, Dr. Garza, I'm looking down at my list of questions. We could probably ask you them for the next hour and a half, but we'll let you go this afternoon. But we guarantee we'll be asking you to come right back on here in a future newscast to answer our questions. We sure appreciate your time this afternoon.
Sure, no problem. Have a good day.
You as well. Thank you.